All right, so we should start really, otherwise we're going to really waste our panelists' time. So apologies for the delayed start, guys. We had a Zoom glitch, which meant that our panelists were not allowed into the system. So we just resolved that. So now we have a full panel of esteemed panelists, all of them leaders in the digital health space in Malaysia. Great, looking forward to hearing their thoughts and insights. To moderate this panel, we have Matt Whittingham. Matt is a recent joinee of the Galen growth team. He's based in Singapore. He leads our insurance vertical commercial activities and partnerships. So his questions tend to come from that angle, but he's rapidly up to speed with the broader digital health ecosystem. Looking forward to hearing your opinions, your insights, and your I guess your tips and tricks as to how we can all be much more successful in the digital health ecosystem based on a vast and deep experience. Galen Growth is running these webinars on a weekly basis, and they are the Together Apart series, and it's a deliberate attempt to not only showcase what's happening within each of the key markets in Asia Pacific, Malaysia being obviously a very near neighbor of Singapore and therefore always on our radar. And of course, more important to hear how the entrepreneurs in the ecosystem are actually addressing the challenges that COVID bring about. And anyone who tells you that COVID hasn't impacted them, he's either been asleep for the last 40 days or is certainly not telling the truth. Fake news hashtag. So very excited to hear how you guys are doing it. We at Galen Growth pride ourselves on being the leader in digital health intelligence, analytics, and matchmaking across Asia Pacific, at least, certainly as we look at Malaysia as a key country in this region. But we have an office in Europe, and we're very focused on similar activities in the rest of the world, Europe and the US as well. Anyway, I'll stop there. I'll hand off to Matt to get the game going, get the panel going. I'm greatly looking forward to hearing what you have to share with us. Matt, over to you.
Yeah, great. Thank you. Thank you for the introduction, Julian. Yeah, Malaysia is emerging from lockdown. The country's been under lockdown for a couple of months, or the MCO, the Movement Control Order as it's known there, but beginning to see some easing of restrictions. I think it's fair to say that Malaysia has fared better than many countries, particularly those in Western Europe. You're probably all familiar with Malaysia, but just a couple of quick facts, just in case you're not. 32 million, roughly, population, split across the Malaysia Peninsula and East Malaysia on the Borneo side, separated by the South China Sea. 74 years average life expectancy, two-tier health system, but a very strong universal health system, supplemented by private, and I'm sure we're going to hear a little bit more about that in a second. I'm delighted to welcome our diverse set of panelists, experts in the health field and entrepreneurs as well from Malaysia. So we have Kevin from QueueMed, Martin from CARE Concierge, Yong from Advanx Health, and Maran from DoctorOnCall. So we're going to hear a little bit about how have they adapted to the challenge of COVID in Malaysia. How are they coping right now? And perhaps a little bit of thinking around the future and what COVID means for Malaysia moving forward. Just a little bit of housekeeping. You'll see a few polls and questionnaires popping up from time to time, so please feel free to fill some of those in. If you have any Q&A, please drop your Q&A into the Q&A box within Zoom at the bottom there. We have some topics that we're going to run through first, but I hope we get time to answer a few of your Q&A as we go. So without further ado, let me hand over and introduce, or get the panel to introduce themselves. We'll hear a little bit about who they are and their particular venture that they are leading. So Maran, over to you to start us off.
Hi, good afternoon, guys, and thank you for having me on this event over here. So a little bit about DoctorOnCall. We are Malaysia's first telehealth organization. We started about 4 years ago, and since then we've added on a diverse set of services to cater to our groups of customers. So that includes our telehealth services, as I mentioned earlier. Secondly, we've moved on to provide medication delivery facilities. We also have Malaysia's largest digital health blog with 50,000 articles and videos, which caters to the specific needs, the healthcare needs of both Bahasa speakers as well as English speakers. We also run a health forum that allows for patients to inquire about their healthcare needs and get medical professionals to provide healthcare in a very timely and accessible manner. And lastly, all our health services comes together to provide services both to retail customers as well as insurance and corporate payers, because we do recognize that the payer market is a significant contributor to the healthcare space. So we try to provide a healthcare ecosystem that caters both to the payers, be it the insurers, the corporates, the state governments, as well as provide an open playing field to the providers comprising of the doctors, the clinics and hospital, the labs providers, as well as the pharmacists. So that's a little bit about DoctorOnCall, and I'm happy to share with you more as time goes.
Great, super. Thanks, Maran. Martin, over to you.
Great, thanks. Thanks, Matt. So hi, I'm Martin. I'm the founder and CEO of CARE Concierge. CARE Concierge provides nurses, therapists, and caregivers to the home for post-hospitalization, recovery, and elder care. And we're supported by a proprietary tech platform. What we also do is that we do design and operate and what we call managed care services, where we actually operate nursing home facilities, premier assisted living centers. We call them independent living units and assisted living units. So we have centers across Selangor, and as well as we actually operate and run daycare centers. So these centers, in fact, is actually one of the two commercially daycare centers in the world to be actually focusing on the care of the elderly and also our services on the ground. Besides that, we also, in order to maintain the standard and quality of care, we actually have our own training center as well. We actually work with the university here, Utah. So we actually train about 1,500 nurses, therapists, and caregivers, and we send them across all our services. Yeah.
Great. Look forward to hearing more, but thanks for that, Martin. Yong, over to you to hear a bit about Advanx Health.
Hi, thanks for the invitation. Happy to be here. My name is Shian, or you can call me Yong. I'm a co-founder and CEO of Advanx Health. So Advanx Health basically started 2 years ago, and our main objective is to enable preventive care and personalized healthcare. So we started doing genetic testing in Malaysia, where we sell direct to consumer from the perspective of health, wellness, diet, fitness, and currently we're also looking into very specific products like prenatal testing or even career testing for those who want to do like family planning. So we look into a lot of things in the body where we wanted to empower people to to know themselves better so that they can use a better products and use a more personalized healthcare so that they can target what they wanted to do.
Super, fascinating. Thank you for that, Yong. Kev, over to you.
Yeah. Thanks for the opportunity for us to share about QueueMed, what QueueMed doing. So my name is Dr. Kev here. I'm the co-founder and CEO of QueueMed. So QueueMed was founded around 2018, 2 years back. So what we specialize in doing is online appointment and also mobile queue solutions. So I myself is a medical doctor with 7 years experience in multiple IT-enabled hospital. So being a doctor myself, I definitely understand in this healthcare industry, there's a lot of pain point worth to be solved. But long waiting time and poor waiting time expectations is always my priority. So I believe all of you must have been in this kind of scenario. You want to go for some medical attentions. You thought you will settle it within 1 to 2 hours, but in fact, you will spend like half a day wasted in the medical center. So what we want to do is we want to better manage the patient flow by allow the patients to have better control on their waiting time. So our solutions allow patients to book online from various sources, and they also can check in online and get the queue ticket. So from there, they can actually monitor how many patients in front of them and also how long is the estimated waiting time. So this can definitely allow them to better plan their journey. So it's like how they use their Google Map and Waze when they want to visit their healthcare doctors. So in short, QueueMed is an all-to-all company, which is specialized in managing patient flow. So we have online components where online booking, on mobile live queue. We also have a lot of offline components where we have the QTV channel in the premise, we have the kiosk, we have the ticket printer in the premise. So that's what we do the best.
Super, thank you, Dr. Kev. So really interesting set of ventures in Malaysia, and clearly all of them have had a role to play within COVID and how the country and you've been responding to that. We're very curious to know a little bit, if you cast your mind back, I guess it's 5 to 6 months now, when you first heard coming from Wuhan, the first stories of this outbreak, and then we saw the story unravel and become known that it was some kind of pandemic. Very curious to understand sort of where were you when you heard that news? What went through your mind as the story developed and we got to know that this could be quite serious? Maran, over to you.
All right, thanks, Matt. It's a bit of a unique story with us over in DoctorOnCall, pretty eventful one too. I was actually over in China when the news unraveled back in early mid-December. We were up there meeting a whole group of partners and investors, and as we flew down from Hong Kong and over to KL, and this little known disease started unraveling. The first question that comes about to you is, did you get infected, right? Largely because that was really the news in Malaysia. Fair bit of misinformation about travelers, about the risks, the symptoms, and I could really empathize with a whole bunch of people asking very similar questions around COVID-19, and just struggling with the lack of information as the disease started unraveling. So back in late January and early Feb, I think it all came to a head in Malaysia with the clinic kesihatan, be the government clinics and hospitals inundated, with patients coming in with influenza or pneumonia or COVID-like symptoms. You just couldn't tell them apart, right, at that point of time. And we then started reaching out the same government, the Ministry of Health, asking them whether they needed help. And fair enough, the Ministry of Health, specifically the minister at that point of time, reached out to the digital health players, asking how could we resolve this high traffic and high volume of inquiries, which are fairly simple, but needed urgent and immediate attention. And that's when we proposed to them how digital health could offer a scalable and a pretty safe way, a smart way at that, to actually address this conundrum that they were facing. We came out with a model in which we told them we were dealing with 2 or 3 million inquiries, or not inquiries, visits, and to our website already at that point in time. And the way to manage that is through a funnel, which is not too dissimilar from what you actually do in the physical space of things, right? And we just need to transpose that across to the digital realm. So we offered them our health blogs, our health forums, the telemed capability, and as well as the risk assessments and a whole bunch of tools which we customized with Kementerian Kesihatan or Ministry of Health. And we helped them at that point of time address that situation, as well as open up the situation to be resolved by a combination of both the government or public sector as well as the private healthcare players. And so that entire exercise of integrating with them took about a week, but we could really see some serious tractions with about 5 million over people visiting DoctorOnCall over that period, and us processing thousands of actually millions of risk assessments and inquiries, and then channeling this to both the public as well as the private labs for the testing to be done in a more cohesive and comprehensive manner, and for the data flow then to come back to Ministry of Health for them to actually get a handle of the situation. Obviously, it was a concerted effort by the industries. You had various players coming on board to help, but from the start of actually dawning on you that it's a massive issue, and then trying to get your head wrapped around it, and then jumping on board to resolve it. It was a heck of a journey, and it was really I'm pretty blessed and thankful the fact that we had strong leadership from the Ministry of Health as well as a concerted effort from the industry.
Thanks, Maran. Yeah, it sounds like from what I've been reading that the Malaysia kind of government and health response was very thorough, and we're going to come on to that in a little bit more detail in a second. Martin, how about you? What were your kind of first reactions when you heard about COVID?
So my first reactions was quite interesting because early in January that time, we were actually finalists for the Southeast Asia Alibaba Jumpstarter campaign competition. So we were actually supposed to fly to Hong Kong to go for the competition, and that was all cancelled. So we actually had to do a virtual competition by itself. But that was the kind of time that we knew that things were a bit different there. Even though this is in China and Hong Kong, it started to kind of creep in here. But from a personal time as well, even before the MCO came up, because we are taking care of a lot of the elderly, right, the seniors and those that are having chronic conditions. So we were always monitoring to see, in terms of how we could take care of them, or because we have 8 centers that we have to take care of them, as well as our home care. So there was always a worry in terms of how we would whether or not this was a contagious condition, and therefore we had to create our SOPs. But because we had used our systems, we actually predetermined in terms of before the lockdown, we actually had our own system to say we have to reduce the people coming in and things like that. So that in a way we had to be very much on cue, and so when it happened, the other thing to note is that literally we were actually launching our 60-bed facility during that period. And on the day that it locked down, we actually hadn't even finished half of the building, but we had to then continue to persevere to actually renovate it as fast as possible internally, because we also had people coming in, from the hospitals when they were checking out. A lot of them were focusing on COVID-19, but there was also a lot of the patients that had to leave the hospital, and then because we had our own center and rooms and our nurses, then we had to get ready for them too. So in a sense, it was quite an interesting time. But yes, during that whole period, we were monitoring, and so when the MCO happened, we were kind of ready for that. Yeah.
Great stuff. Great stuff. Yong, Advanx Health. What was the situation with you when you heard about COVID?
So I think I might be, if compare to Maran and Martin, I could be a little bit late knowing the news, because I first heard of, used to call Wuhan virus, well now COVID-19. It was during Chinese New Year, because I have a relative in China who are unable to come back because China is going to lock down. So I think that time China makes a very, very big decision, is to lock down the country, even though it's a festive season, like people going back home to celebrate Chinese New Year. But they decided to lock down. My relative can't come back because apparently she was fever during the day she had to fly off. So she was stuck there, I think, until now. So when I heard of it, I thought it's just like a SARS, to be very honest. I never thought it could be as a pandemic, like it was affecting the whole world. So personally, I think I might felt the effect for COVID-19 a little bit later compared to Maran and Martin. But as a business, we are in the brink of getting, because we are supposed to have exhibition in Singapore, I think February and March. So both are cancelled. Now it's postponed until next year. As for our business, we are also in the brink of preparing our lab. So we're still going forward for getting our lab to be ready. But then right now things have changed. Probably I'll share about the lab later. But then in terms of the response, at the first, I don't think I felt as strong as now towards COVID-19. But now we all know it's a pandemic.
And Yong, do you want to just tell us a little bit more about your testing? Because I think you did some kind of little bit of a pivot, didn't you, from kind of genomics and your normal sort of venture. Is that right? Did you start to look at testing around COVID?
Yeah, because so we started our lab in beginning of March. So it was actually just right before MCO. So after the MCO, our lab was closed because we just installed our equipment. We still haven't run QA. We just haven't run the operational testing yet. After that, we studied a lot into PCR testing. Apparently, our lab has facilities that can be has the capacity and capability to actually run PCR testing. So right now, we are actually looking into helping to run some of the PCR tests because we know that they might wanted to have a lot more tests coming up to cater to the needs for even maybe workers or moving forward if vaccine is not found. So we are currently preparing our lab to be able to run PCR testing. We are still tweaking some of the protocols and to make sure the operations and the procedure are right. But fortunately, I think this put our lab to be ready to actually run the test. So I would say we are in lucky spaces where this year we actually invested into a lab, and now we try to contribute our lab towards fighting this pandemic.
Yeah, great. Dr. Kev, what about you? And where were you in your first reaction to COVID?
Yeah. So I was similar with Yong. I think I was a bit surprised. I didn't expect the COVID will spread so fast when they're talking about Wuhan virus and how well China is containing the virus. I didn't expect it to be spreading so fast in Malaysia. So when it comes to February, March, to the time when we have a lot of political drama in Malaysia at the time, and that's where this COVID started to raise the case in Malaysia. At that particular time, actually, what we company QueueMed is focusing is expanding our business in all these private clinics. So when the government issued the strict MCO, the lockdown, it actually affected our business because we are all-to-all business. We have a lot of setup in the clinic itself. We have a lot of training in the clinic itself. So once the MCO came in, actually a lot of technical works, we have to find another way to solve it. So that actually come a surprise to us. But at the same time, we are also feeling very lucky because what we're doing in managing the patient flow is somehow can help the Ministry of Health in solving the new norm, promoting the social distancing. So actually, we are also appointed by the Ministry of Health of Malaysia by introducing the online appointment system for the government health clinic at the same time. So this is what we go through during this COVID-19 pandemic.
So sort of sticking with that theme, because clearly all of your organizations have had a role to play in this. From previous webinars, we've been talking to lots of startups and entrepreneurs, and particularly around telemedicine and telehealth, and seeing the uptick in just volume. It would be great to hear a little bit more about how you've seen the volume increase in your particular organization. Maran, you spoke a little bit about this already. I think you mentioned you saw a kind of spike of 3 million visitors to your website. Can you give us a sense of kind of the increase in volume, and have you seen that continue?
Right. So I think you probably need to look at it from two phases, right, or three. So we were already doing about 1 million over visitors to our site, but when the entire scare, right, and ensuing issues around misinformation and fake infos, as well as the outreach program that was done by the government in terms of sending text messages and WhatsApp messages to the public for them to actually come to a single source of truth, which was DoctorOnCall at that point in time as a seconded instrument of the Ministry of Health. We then had a surge of close to 5 over million visitors. during that period. And and servers were burning down. Our services was pretty patchy at that point in time, and we just cannot threw all our resources to just deal with that entire issue. That process of actually getting everyone on board to a digital health platform for them to actually to educate them, right, and clarify as well as resolve some of this misinformation, then panned out or started trickling down to the transactions in terms of them actually performing inquiries and as well as consults and risk assessments on our platform. And I think we had about 2 over million risk assessments done, close to 40,000 consults being performed on the platform, and this was in combination of both the private as well as the government or the public service medical providers. As the lockdown was then imposed, or the MCO, and the second phase of the control MCO or the CMCO, we then started seeing how patients who were suffering from chronic conditions or genuine medical concerns, right, needed a channel for them to perform, to get their consults for their diabetic or hypertensive or a real genuine medical consult or medication purchase. They then came onto our platform to perform that. Those series of transactions, right? So it was just more than information gathering and clarifying, but this was real consults with doctors. They also needed to do lab bookings for the COVID-19 test. So that number spiked up to about 3.5 times our pre-COVID phase. And then as the CMCO started easing out the travel restrictions, as well as the, I think a lot of the GPs, or the GPs being the medical practitioners, could open up their clinics and get back to some form of normalcy, that number started tapering down. But again, it's a fair higher number than what we had pre-COVID. And I think it's as a result of COVID-19 being a catalyst in forcing everyone to have to live in this new paradigm, right? And I think this webinar is a classic example. We typically would have had a physical interaction in Singapore, but just a sign of the times, right, that we're doing this this webinar online. And so the patients who were accustomed to or slowly getting accustomed to doing a teleconsult or a lab booking or medication dispensing exercise started getting normal, and we started seeing a fair high number of people using our services. And I think it's comforting to know that the paradigm shift didn't just happen over with the users, but it also happened with the doctors. It transformed the doctors' thinking about being open to leveraging on alternative channels for them to service their patients and to actually meet their patients' needs. And now we're getting doctors on board to our platform through a partnership. Even we're talking to Dr. Kev from QueueMed on how we can enable the entire ecosystem to really help the doctors, because I think the major challenge that we're going to face in the next 6 to 12 months is not really COVID-19, but the COVID-19-led recession that's going to have a major economic impact to both the providers as well as the payers.
Just a quick supplemental. So a threefold increase in demand, and yet it's quite difficult in lockdown to sort of scale the business. How did you, just very briefly, how did you get the doctors on board to service that increase in demand? Right.
And I think that talks to the power of digital health, right? In the sense that it's an extremely scalable model, bedded down by a very strong infrastructure, more than just the having the medication delivery guys, but in terms of the doctors, we have a pretty strong set of or robust network of doctors who could onboard their counterparts onto our platform in a fairly fast time, right? Because the doctors in Malaysia have their annual practicing certificate. We tend to use a more tempered or more pragmatic approach of having them invite their fellow colleagues, because you typically get better performing or higher quality doctors in terms of patient outcomes as well as bedside manners. And so we could get them onboarded, and we had a training module that that allowed us to train them even when they were outside the geographical area. And so we could really scale, and this also was transposed or parlayed across to the pharmacy group. So we got large pharmacy chains coming on board, and again, they had great set of standards, and they could connect their SOPs to our SOPs and roll it out in a fairly short period of time.
Great story. Same question to you, Martin. Probably, I guess, a slightly different experience, but have you seen an increase in demand for your services, and how have you gone about coping with that increase in demand?
All right. Thanks, Matt. Well, we've been quite fortunate. I think part of our services is, in a way, essential services. So we've actually shown some growth in the last month. Same thing in terms of our operation-wise. The very fact is that even our homes itself, the ones that we have launched, we actually were able to get up to 40% occupancy in a short time. In fact, now it's actually going into the 70% occupancy rate. I guess the impact of all this is that we do have, we were quite essential. Like, if you talk about doing MCO, a lot of the elderly and the seniors, they are still staying at home. They need some care. So we were able to do that and also deploy our nurses across nationwide to be able to service this sector. The other thing to note is that, during this period, we also had some good self-reflection, and also now we're actually working with a lot of partners. In fact, DoctorOnCall Maran, we're actually working with him as well in terms of actually doing, we pivot a little bit to actually include COVID-19 testing. Part of our services also, we reflected and said that besides just also taking care of the senior and post-hospitalization, it's also about the very fact that the next few months is about getting our economy back on track. And in order to do that, we are looking at getting companies, also helping out by deploying our nurses to do this COVID-19 screening, so the PCR test, as well as also having things like digital screening, thermal sensors that we can use to help them, and then also having our nurses there, because by having our trained nurses and professional caregivers, we can also provide them with advice, also take care of things where we realize that family members may, when they're spending time at home, they realize that, they also need someone to care for the elderly, and sometimes they need an additional help. So all this comes together to, in terms of us growing our business, and at the same time being very relevant to help out with the, with the people in Malaysia. Yeah.
Great. Thanks for that, Martin. Yong, over to you. What was your experience like in terms of, have you seen an increase in demand for your services?
So I think we are very different from Martin and Maran's businesses, because they are more like a frontline, where telehealth, CARE Concierge are more towards the care. We are more like a product where people wanted to know more about themselves. But actually, without COVID-19, we will never know that we are in the position to also serve this kind of market, where we are around ourselves with testing, right? We do genetic testing, and then right now we are looking into PCR testing. Previously, when our government was talking about rapid test kit, we also get a lot of people approach us like, can you help us to distribute some of the rapid test kit to clinics, or help us to educate the market about what is rapid test kit. So I think our focus are still around tests, whether it be PCR testing or rapid test kit. So we definitely see a huge demand over there. And when the MCO started, or we call movement control order started, our team quickly do a website called Find My Test, where we actually featured companies like even DoctorOnCall, basically a platform where to help people to find their nearby places for COVID-19 testing. So even right now, every day we receive people asking, where can I do a COVID-19 test in my states? So that platform actually gathers all the different clinics, hospitals, or even players like DoctorOnCall, Doctors who provide on-site testing. So we just refer them to, you can go to Pantai Hospital for drive-through. You can go to DoctorOnCall if you want to go for like a at-home testing. So we make a directory so that people can easily browse through. Until today, we still receive a lot of questions coming, just PM us. I want 4 tests for my workers. Where can I go for? So I think this trend is still going to be there. And as for us, how we react is, we use this directory to help Malaysians to find the nearby tests. And for us is to get our lab ready, so we can also cater some of the demands out there. But for us, it's not more on consumer, but we'd rather see a growth on companies like pharma. So we have a partnership with Roche, where they have a product called non-invasive prenatal testing, NIPT. So it's basically for pregnant women to find out does their baby has a chance of getting a certain genetic disorder like Down syndrome. Roche sees this as a chance for digital channels to acquire new customer. And apparently we are in a digital spaces. We signed a partnership with Roche, and this actually COVID-19 accelerate the kind of process going through. A pharma company wanted to use a digital channel to acquire new customer, or for patient engagement. I think that same goes to QueueMed, where MOH get them to talk about queue system. I think COVID-19 definitely ramp up some of the progress over there. So as for us, more towards pharma company work with us in terms of new digital channels towards acquire customer.
Got it. Okay, very interesting. Dr. Kev, what about you? I thought QueueMed, you're kind of much more kind of front line. What was the experience in seeing increase in demand, and how did you cope meeting that demand?
What QueueMed do is we are B2B company. Mainly we are dealing with a lot of clinics dealing with a lot of doctors. So I would say definitely COVID would be one of the biggest catalysts for digital healthcare transformation in Malaysia ecosystem per se. Before this COVID-19, when we want to go push the clinics to get on board with this kind of digital solutions, it's always a very difficult task. I believe digital healthcare, healthcare industry compared to other industry, be it like e-hailing, food delivery, e-commerce, is very lag behind in terms of digital transformations. Mainly, I say healthcare is a relatively regulated, highly regulated, a lot of regulations. And actually partly because of the mindset of the healthcare provider, we are more protective. Even we are reluctant to adopt new things. We are comfortable with our own way of treating patients. So during this COVID-19, actually, we face a lot of difference of requests. Before COVID-19, we need to really persuade doctors to get on board with us. We need to really educate them about what is digital healthcare, what are these solutions for, how can it add value for your practice. But during this COVID-19, we get actually organic growth. The clinic actually come to us and asking us whether can we provide this kind of a drive-through solution, this kind of a live queue solution for them to better manage their clinics. And I think when there is a desperate, there is an opportunity for us. So I definitely feel this then speed up the digital transformation of healthcare industry. So for us, we managed to get 120 clinics on board with us. I think 80% will be within this first half year. So there is an impact for us.
That's great. And I'm just looking at the Q&A here, and a couple for you, Kev. You've answered one of them, which I think was the number of clinics and hospitals onboarded. So that's 120, is it currently?
Yeah, 120 is private clinics. We also getting a government health clinic. So we are getting 4, but we already have another 4 on board with us. So I think we have 8 currently, government health clinics and with the private.
And is that across all states in Malaysia, on both sides of the sea? How does that look geographically?
I would say 70% to 80% would be in Kuala Lumpur, the Klang Valley regions, but we do have clinics and even government healthcare clinic as far as Sabah, Johor, Sungai Petani in Alor Star. Yeah.
Okay, and one more. I'm reading from questions from KC here on the Q&A. One final one for you, Kev, just on this topic. In terms of your platform, is your platform across mobile as well as laptop? I would assume it would be.
Yeah, because we are using PWA, so it can be accessed through laptop, mobile, or we can plug into other healthcare player mobile app, or even we are in the MySejahtera app. In MySejahtera is the government's applications to promote this kind of healthcare awareness in Malaysia.
Yeah, great. Okay, I'm just going to stick with a couple more Q&A. There's a couple here from Maran. You might have answered one of these already, Maran, but question from Anurag Agrawal. What will it take to drive rapid adoption of telemedicine by patients and hospitals in Malaysia? I think you've slightly answered that already. I mean, clearly things like COVID are a big accelerator of this. So that's one piece. How will that rapid adoption continue? There was also a question from Gary. He was talking about subsidies for telehealth, and I'm not sure if that's the case in Malaysia in terms of government subsidies, which perhaps help drive, a lot of volume. If those subsidies start to, question, do you think those subsidies will start to fall away? And what do you think the long-term sort of trend in traffic and usage of your service will be?
Right. Fairly complex question or a set of discussion points, right? So there's a common joke among doctors in Malaysia. I'm not a doctor, unlike some of the panelists over here. But a common joke is that as a private medical practitioner, you're always competing against the 1 ringgit or the 5 ringgit service provider, the government. All right. So it's extremely tough for many of the private practitioners to actually provide a decent standard of care when the government actually provides a pretty decent standard of care too at a heavily subsidized price. Obviously, it comes with its own set of challenges in terms of long waiting queues, lines, generic medications, medication running out in certain places, as well as antiquated set of infrastructure. But it's extremely difficult to compete with a competitor in that space, right, in terms of the Malaysian healthcare GDP that is heavily subsidized. And I think the way to look at it is rather than, and the government's subsidy issue has been a perennial issue for the government itself, as it recognizes that the healthcare CAGR or increase in cost of 20 to 30% year on year, driven by an aging population, and a population that has a high rate of NCDs, right, led by the obesity epidemic in Malaysia, the lack of education around preventive healthcare, all causes a massive set of funding issue for the government, right? And so trying to resolve this in a way to remove the subsidies is going to be highly unpopular. We know that we now live in a pretty fractured political system right now with competing interests by the relevant parties. So my take as a non-political, non-public service servant would be to look at it from a healthcare ecosystem for players like us to come together and allow for the private healthcare providers, be it the doctors, the clinics, the labs, the pharmacies, all of them to get on our platform and to allow for the patient then, which currently is resigned to the fact that they go to a clinic that's in their opinion expensive, and also we spoke about the numerous issues around again the long waiting lines that Dr. Kev was talking about, and the limited amount of inventory, all those kind of issues, right? We try to resolve it through the digital means. And what I'm hoping for is the transparency on price, service providers will all allow for the best in the industry, or the ones who want to take the most amount of effort to actually thrive, right? In light of this competition, and for then the government to see that, okay, digital health is a key enabler. It's not meant to kill or steal the rice bowl of the relevant providers, right? It allows for transparency of all the information that I just mentioned to you, and all of this culminates in the government eventually adopting digital health for themselves, right? And allowing the patients to have at their discretion the option to either go to the public service facilities right now at the highly subsidized price, or to actually make a payment through these digital means to the public servants themselves, right? It may take a Herculean public or political, shift of mind, but if they do this, this will then be the first step in allowing for a single payer system or universal healthcare coverage funded by the public parties, right? Both public and private. And I think Malaysia has the necessary ingredients to bring all of this together. It just takes the political will, as well as an open-minded set of participants to go there. Because COVID-19 is already the catalyst to drive the adoption. And I hope they kind of answer the question to the members over here. I think so. It's a bit different from Indonesia, where there's a huge economic issue over there. But with Malaysia, with COVID-19 coming to a tapering off, we can actually start looking at this in a more analytical and pragmatic way.
Great answer. Thank you for that. Sticking with the theme, I guess, of the future, and is COVID going to be the catalyst for healthcare and an increase in volume, and will that continue? Let's just open that up a little bit. Martin, what's your view of that? Are we at a decisive inflection point for digital health and in your business?
I think COVID-19 has changed everything, right? The entire way works. I think from our perspective, more focusing on the seniors, right? The population, a majority of those that are actually affected by COVID-19 are actually seniors, right? And also the chronic conditions, the ones that we care for. So even in the implementation of our homes itself, everyone has to adapt to a new lifestyle, and therefore the digitalization part of it, like for example, because we do have this lockdown, and then there's not much movement restriction. One of the things that happened is that even the seniors themselves, they cannot get to connect or actually physically meet up with their family members. And so a lot of these issues, like for example, they get depressed, they can't actually have a connection. Then we use the digital part to actually help to bridge that gap. So for us, for our centers, and also for those at home, we actually have our own app, right? Where we actually able to monitor the chats. We're able to check on how mom and dad is doing from a digital point of view. But it also helps to connect them. So they are actually all using Zoom now. We're actually using FaceTime to actually connect with the family members. And the other thing to note is that even there is also a concern about the future, right? So a lot of the services that we now provide is actually to help those, like for example, the nurses to actually go and get stuff from the hospital, and actually or do the services in the home itself, rather than having to go to a facility, a clinic or hospital. So in that sense, the digitalization allows us to then use these medical records and then enable the nurses to actually go to the home and do all these on-demand services. So I guess that's part of that sector. But definitely as part of the digitalization part, part of that whole understanding is that you don't need to physically be there anymore. You can actually use all these services, right? Yeah. So that's part of it.
Great. Thanks, Martin. Same question for Dr. Kev. I guess you've already spoken about the huge increase in volume. Is this the moment? Is this the catalyst for your business, kind of moving forward? I remember we spoke last week about the fact that actually you are now getting clinics coming to you, which is a fantastic position to be in. Do you think you're going to continue to see that after the crisis period of COVID starts to pass?
Yes, I totally agree that, because the thing is, the mindset of a lot of healthcare professionals have already adapt and adopt this kind of digital solutions. So I definitely foresee it'll be easier for us to tap the market in the future. I believe the new norm will stay at least for the next few years. So the new norm will be the social distancing, all these things that need a better patient management flow. So that's why we come in, we help them to better manage their patient flow. Also, we help the country to better control the COVID-19 pandemic.
Okay, great. Yong, what about your business? Is this a key point where you're going to see your volume continue to grow? I mean, we've had you talking about potentially doing testing in your genomics business. Do you see this having any kind of longer term impact on that part of your business?
I think I definitely agree with this pandemic being a catalyst for digital healthcare, be it telemedicine, the online queuing systems, or even different healthcare, what we call online healthcare services. I think people say pandemic is best innovators, so that definitely give a huge catalyst to different digital healthcare, and also sparks the needs of digital healthcare, even to urge our government to be more involved and more invested into this particular landscape. As for us, we are in a genomic spaces. I think last month we actually contributed some of the research into, there are many group of people in Europe and US. They are looking at genomics relationship towards COVID-19. So apparently, it could be a myth, but I would share something over here. Is there are a certain type of genotypes of a person who are more susceptible of getting COVID-19 due to a certain gene that regulate antibodies. So there are research going on towards that direction. And one of the articles from Harvard Medical School is saying they are using sequencing technology and genetic sequencing technology to fasten the process of getting a new vaccine or even a new treatment. So we understand that genomic databases has to be grown in the future, because these databases or even genetic sequencing technology is going to help the future pandemic or even the current pandemic to find solution, to find vaccine, to find treatment even faster. Because when we talk about PCR testing, it's RNA and DNA. So we definitely will see the society provide even healthcare professionals or consumer to understand about the importance of genetics or sequencing technology moving forward. I think that will be the catalyst for our business. And on the other side is because I'm a pharmacist, we work more with retail pharmacy or even pharma. We definitely get a lot more interest from pharma, whereby they're asking us, because their products are going to be a lot more targeted, let's say, gene targeted therapy. So how do they approach the customers is definitely has to do a gene testing. So with all this pandemic happens, they are looking for digital channels to engage customer or to maintain the patient engagement. So we are seeing a lot more conversation going on from the pharma industry and also from the pharmacy industry.
Yeah, that's fascinating. I think a bit of a glimpse of the future. In fact, we were talking actually earlier about distribution of your tests, and I think you've done some interesting kind of retail pharmacy distribution of testing. I'm very interested, just very kind of quick 2 minutes on that, and just curious about pricing. Are you seeing pricing of genome type testing, is that coming down substantially?
There's a few different types of genetic testing technology out there. So what we are using is called genotyping. It's definitely going down, and even the company that we work with is called Illumina. They are actually subsidizing some of the costs for genotyping chips right now. So for fellow Malaysians, if today you walk into Caring Pharmacy, you ask them for DNA testing. We are actually the providers working with Caring Pharmacy. We are the one that run their testing. So although it's a different branding, but then back end, we're actually the one that running DNA testing for Caring Pharmacy. So we launched it, I think, also prior to MCO. But right now, we are working with Caring to see whether we can do webinar or even an online session to educate people about this particular testing. So we will definitely see the cost of testing going downwards. The use of testing will be increasing, but education has to be done in the society, because when people talk about genetic testing, it can be a little bit of scary, because you sort of know what you're inherited with. If we don't educate people about the information that you are getting, they might be misled or having even depressed over, my obesity risk is high. So whatever I did in my life is like, I'm going to be obese anyway. So education has to be done in the right way. Therefore, we are going to launch a series of webinars into different topics that we cover. So just to promote a little bit to all the Malaysians who are listening to this webinar, we are having a webinar about carrier this Saturday. So if you're interested, you can go to our Facebook Advanced Health to look for more information.
Nice plug, like that. Okay, we've only got a couple more minutes. I'm just going to do a bit of Q&A from the audience, and this will be a bit rapid fire. Question from Joyce: can anyone comment on prescribed drugs, how they dispensed from online telemedicine platforms? And I guess curious about, Maran, how that fits in with your platform. Maybe also Kevin, QueueMed, and also just generally, if I go to a doctor in KL, maybe I'm not using one of your platforms, but is there a way for me then to get the prescription and then fulfill that online? Maran, maybe you could quickly comment on that one.
Right. Very quickly, we do allow for both an upload of the prescription. Obviously, our pharmacists will verify the authenticity of the prescription. But the significant number of our consults actually do translate to prescriptions, which will then be dispensed by our partner pharmacists. And so I think there's a common misunderstanding in Malaysia, or a lack of knowledge, that prescribing or performing a consult, arriving at a diagnosis and prescribing prescription drugs online is actually commonly performed in many countries, from US to China to India to Australia. And there's various cases, right, of chronic conditions, medications refilled, very common conditions which the doctors themselves, through history taking, is comfortable enough to offer a prescription. Obviously, in some cases, it translates into a referral for them to get in to an in-person visit and a clinic or a lab for them to do the diagnostics. So really, we allow the doctors who have their own annual practicing certificate and to use their judgment. They are professionals with years of experience of conducting diagnosis face-to-face to perform that online, right? And what we aim to do is to enable them to run a virtual practice comfortably, safely, and take away the burden that a typical SME, a small medium enterprise clinic, right, or a lab or a pharmacist would not be able to do otherwise, by actually investing into the entire customer acquisition, marketing, tech infrastructure. And so I know I'm getting off tangent over here, but the point is that the doctors who are on our platform are comfortable performing this diagnosis and offering the prescription drugs, and the patients themselves are comfortable getting the care that they need.
That just posed another thought, which is last year in the UK, there was commentary around the opiate crisis, which is beginning to spread from the US experience, I think. There was some concern in the UK that perhaps patients could start to possibly game or abuse the systems with multiple online providers. How would you sort of prevent that from happening?
Yeah, so it's a very interesting point that you've picked up on, and something that is heavily being discussed right now with the Ministry of Health in Malaysia as part of the online health services program that they're running to relook at the current existing regulations. But in a nutshell, the pill mills, right, or the abuse can only be managed if we do have some sort of regulation or framework to guide our practitioners and as well as the digital healthcare platforms. And I think what we want to do is avoid the examples in some countries where it's a free for all. And so the medical providers are then, subject to stress and pressure by certain, unscrupulous digital health providers, and then get into trouble. So this opiate crisis, which in a nutshell means a pill mill, right? You're just dispensing indiscriminately to people, can be looked upon by putting in the safeguards and the regulation framework to ensure that we can perform the diagnosis and the consults in a safe manner without jeopardizing the patient's health in the long run. And then we're pretty heartened by the fact that the Ministry of Health has a pretty big vision in terms of doing this, and they're going ahead with actually enabling the regulatory framework.
Yeah, that's great. Sounds very progressive. Right, we're going to wrap things up. I'm going to ask one final question just from the Q&A. Dr. Kev from KC again, actually. 2 quick ones, so we'll just do this in a few seconds. Abusive queuing system, I guess this is around, you get the number, you don't show up, you do that repeatedly. Is there any way to, demerit somebody? And on a slightly more positive thought, can you make payment through your system? So if I'm getting prescriptions for wellness or pharmaceutical, can I manage and pay for that through your platform?
Yeah, these are common questions that on this appointment and queue that we're gonna face a lot issue from the clinic itself. So simple one, just a simple one. How are we gonna reduce the no-show? What we call no-show. So there's few ways. The recommended one is you send a reminder. So we send patients reminder 1 day prior to the appointment, or send reminder to the patient who get a live queue. The other one is like you make a payment. So we incorporate the payment gateway in our portal. So certain clinic actually they put a booking fee. So in order to make a booking, patient need to pay. So when patient make payments, so it's some sort of commitment, so it can reduce all this kind of no-show for the patients.
Yeah, awesome. Hey guys, we're out of time. We could probably go for another hour, I reckon, but thank you so much. It's been really fascinating hearing about your experiences in Malaysia. I'm really looking forward to the travel restrictions being lifted so I can go out and have some amazing food up in KL. But I wish you all the best with your ventures and the contribution you're making to healthcare and getting through the COVID crisis. It's been fascinating. Thank you so much. I'm going to hand, I think, briefly back to Julian. You might just say a few words to wrap up quickly. Julian?
Very quickly then, thank you very much to our panelists and their great insights. It's always good to hear how one specific ecosystem is acting, behaving, and leading. And it's great to be able to compare it to other ecosystems across the region, particularly around Southeast Asia, where there are obviously there is a strong network between the innovators. Thank you, Matt, for stewarding us through this panel. It's always never enough time, and there's always many more questions. So really appreciate the time you've given us as a panel as a whole. Keep an eye on our webpage, particularly the events page, where you'll see some of our other forthcoming panels. And you'll see Matt coming back to facilitate a panel dedicated to insurers and how insurers are looking at digital health, which of course is particularly timely in view of the fact that insurers are weathering COVID-19, I guess, in a hard manner, let's say. and therefore are starting to review their business models and how they look at digital health. So very excited to see that perspective and to look at how they're looking at categories like digital therapeutics, how they're looking at categories like biomarkers, etc., which we know are close to their minds as they talk digital health. Thank you very much to everyone, and looking forward to seeing you all again next week.
Thank you.
All right. Thank you, guys.
Thank you very much.
Thank you, Matt. Have a good one.
Thanks, guys. Thanks, Matt.
All right. See you
Everyone
guys.
stay safe.
Ciao then.
All right.